A client with acute pancreatitis has a blood pressure of 88/40, heart rate of 128 beats per minute, respirations of 28 breaths per minute, and Gray-Turner's sign. What action should the nurse perform first? 1. Assess the urine output. 2. Place an intravenous line. 3. Position on the left side. 4. Insert a nasogastric tube. The correct answer is 2. Place an intravenous line. Gray-Turner's sign is a bluish discoloration in the flank area caused by retroperitoneal bleeding. The vital signs are showing hemodynamic instability. IV access should be obtained to provide immediate volume replacement. The urine output will provide information on the fluid status. A nasogastric tube is indicated for clients with uncontrolled nausea and vomiting or gastric distension. Repositioning the client may be considered for pain management once the client's vital signs are stable. The client who has been hospitalized with pancreatitis does not drink alcohol because of her religious convictions. She becomes upset when the physician persists in asking her about alcohol intake. The nurse should explain that the reason for these questions is that 1. There is a strong link between alcohol use and acute pancreatitis. 2. Alcohol intake can interfere with the tests used to diagnose pancreatitis. 3. Alcoholism is a major health problem, and all clients are questioned about alcohol intake. 4. The physician must obtain the pertinent facts, regardless of religious beliefs. The correct answer is 1. There is a strong link between alcohol use and acute pancreatitis. Alcoholism is a major cause of acute pancreatitis in the United States and Canada. Because some clients are reluctant to discuss alcohol use, staff may inquire about it in several ways. Generally, alcohol intake does not interfere with the tests used to diagnose pancreatitis. Recent ingestion of large amounts of alcohol, however, may cause an increased serum amylase level. Large amounts of ethyl and methyl alcohol may produce an elevated urinary amylase concentration. All clients are asked about alcohol and drug use on hospital admission, but this information is especially pertinent for clients with pancreatitis. Physicians do need to seek facts, but this can be done while respecting the client's religious beliefs. Respecting religious beliefs is important in providing holistic client care. After a client who has had a laparoscopic cholecystectomy receives discharge instructions, which of the following client statements would indicate that the teaching has been successful? Select all that apply. 1. I can resume my normal diet when I want. 2. I need to avoid driving for about 4 weeks. 3. I may experience some pain in my right shoulder. 4. I should spend 2 to 3 days in bed before resuming activity. 5. I can take a shower 2 days later. The correct answers are 1. I can resume my normal diet when I want. 3. I may experience some pain in my right shoulder. And 5. I can take a shower 2 days later. Following a laparoscopic cholecystectomy, the client can resume a normal diet as tolerated. The client may experience right shoulder pain from the gas that was used to inflate the abdomen during surgery. The puncture site should be cleansed daily with mild soap and water. If a Band-Aid was applied after surgery, it can be patted dry or removed and replaced. Driving can usually be resumed in 3 to 4 days following surgery, and there is no need for the client to maintain bed rest in the days following surgery. Light exercise such as walking can be resumed immediately. A client undergoes a laparoscopic cholecystectomy. Which of the following dietary instructions should the nurse give the client immediately after surgery? 1. You cannot eat or drink anything for 24 hours. 2. You may resume your normal diet the day after your surgery. 3. Drink liquids today and eat lightly for a few days. 4. You can progress from a liquid to a bland diet as tolerated. The correct answer is 3. Drink liquids today and eat lightly for a few days. Immediately after surgery, the client will drink liquids. A light diet can be resumed the day after surgery. There is no need for the client to remain on nothing by mouth status after surgery because peristaltic bowel activity should not be affected. The client will probably not be able to tolerate a full meal comfortably the day after surgery. There is no need for the client to stay on a bland diet after a laparoscopic cholecystectomy. The client should, however, avoid excessive fats. A client is receiving an IV infusion of heparin sodium at 1,200 units per hour. The dilution is 25,000 units per 500 milliliters. How many milliliters per hour will this client receive? The correct answer is 24 milliliters per hour. To solve this problem, first, calculate how many units are in each milliliter of the medication. The questions gives us 25,000 units per 500 milliliters. 25,000 units divided by 500 equals to 50 units. 500 milliliters divided by 500 equals to 1 milliliter. So it's 50 units per 1 milliliter. Next, calculate how many milliliters the client receives per hour. Since the client is receiving 1,200 units per hour and there is 50 units per 1 milliliter, we divide 1,200 by 50, which equals to 24. So the client is receiving 24 milliliter per hour. A client with cholecystitis continues to have severe right upper quadrant pain. The nurse obtains the following vital signs: temperature 38.4 degrees Celsius, pulse 114, respirations 22, blood pressure 142/90. Using the S-bar technique for communication, the nurse recommends to the primary care provider for the client to receive 1. Hydromorphone IV. 2. Dultayazem PO. 3. Meperidine IM. 4. Promethazine IM. The correct answer is 1. Hydromorphone IV. Hydromorphone should be considered for pain management. It should be administered intravenously for rapid action to address the severe pain the client is experiencing. Intramuscular injections are painful and slower acting. Since meperidine's toxic metabolite can cause seizures, it is no longer the treatment choice for pain. Dultayazem, a calcium channel blocker, is not indicated. Elevation of heart rate and blood pressure is likely due to pain and fever. Promethazine is used to treat nausea. The nurse is caring for a client who had an open cholecystectomy 24 hours ago. The client's vital signs have been stable over the last 24 hours, with most recent temperature 37 degrees Celsius, blood pressure 118/76, respiratory rate 16 breaths per minute, and heart rate 78 beats per minute, but are now changing. Which of the following indicate that the nurse should contact the physician? 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. 2. Temperature 38.2 degrees Celsius, blood pressure 118/68, heart rate 84 beats per minute, respiratory rate 20 breaths per minute. 3. Temperature 37.5 degrees Celsius, blood pressure 126/80, heart rate 58 beats per minute, respiratory rate 16 breaths per minute. 4. Temperature 36.4 degrees Celsius, blood pressure 98/64, heart rate 98 beats per minute, respiratory rate 18 breaths per minute. The correct answer is 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. This client is exhibiting 3 of 4 signs of systemic inflammatory response syndrome: temperature greater than 38 degrees Celsius or less than 36 degrees Celsius, heart rate greater than 90 beats per minute, respiratory rate greater than 20 breaths per minute. The fourth indicator is an abnormal white blood cell count, greater than 12,000, less than 4,000, or greater than 10% bands. At least 2 of these variables are required to define systemic inflammatory response syndrome. At 8 a.m., the nurse reviews the amount of T-tube drainage for a client who underwent an open cholecystectomy yesterday. After reviewing the output record, the nurse should 1. Report the 24-hour drainage amount at 12 noon. 2. Clamp the T-tube. 3. Evaluate the tube for patency. 4. Irrigate the T-tube. The correct answer is 3. Evaluate the tube for patency. The T-tube should drain approximately 300 to 500 ml in the first 24 hours, and after 3 to 4 days, the amount should decrease to less than 200 ml in 24 hours. With the sudden decrease in drainage at 8 a.m., the nurse should immediately assess the tube for obstruction of flow that can be caused by kinks in the tube or the client lying on the tube. Drainage color must also be assessed for signs of bleeding. The tube should not be irrigated or clamped without a prescription. A client who has been scheduled to have a cholecystectomy expresses anxiety about having surgery. Which nursing intervention would be the most appropriate to achieve the outcome of anxiety reduction? 1. Providing the client with information about what to expect post-operatively. 2. Telling the client it is normal to be afraid. 3. Reassuring the client by saying that surgery is a common procedure. 4. Stressing the importance of following the physician's instructions after surgery. The correct answer is 1. Providing the client with information about what to expect post-operatively. Providing information can help to answer the client's questions and decrease anxiety. Fear of the unknown can increase anxiety. Telling the client not to be afraid, that the procedure is common, or to follow her physician's prescriptions will not necessarily decrease anxiety. The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm on the monitor. See the electrocardiogram strip below. The nurse should 1. Notify the physician. 2. Call the rapid response team. 3. Assess the client for changes in the rhythm. 4. Administer lidocaine as prescribed. The correct answer is 3. Assess the client for changes in the rhythm. The client is experiencing a single PVC. PVCs are characterized by a QRS of longer than 0.12 second and by a wide, notched, or slurred QRS complex. There is no P wave related to the QRS complex, and the T wave is usually inverted. PVCs are potentially serious and can lead to ventricular fibrillation or cardiac arrest when they occur more than 6 to 10 in an hour in clients with myocardial infarction. The nurse should continue to monitor the client and note if the PVCs are increasing. It is not necessary to notify the physician or call the rapid response team at this point. Lidocaine is not indicated from the data on this ECG. A client is admitted to the hospital with a diagnosis of cholecystitis from cholelithiasis. The client has severe abdominal pain and nausea and has vomited several times. Based on these data, which nursing action would have the highest priority for intervention at this time? 1. Manage anxiety. 2. Restore fluid loss. 3. Manage the pain. 4. Replace nutritional loss. The correct answer is 3. Manage the pain. The priority for nursing care at this time is to decrease the client's severe abdominal pain. The pain, which is frequently accompanied by nausea and vomiting, is caused by biliary spasm. Opioid analgesics are given to relieve the severe pain and spasm of cholecystitis. Relief of pain may decrease nausea and vomiting and thereby decrease the client's likelihood of developing further complications, such as severe fluid loss and inadequate nutrition. There are no data to suggest that the client is anxious. A client has undergone a laparoscopic cholecystectomy. Which of the following instructions should the nurse include in the discharge teaching? 1. Empty the bile bag daily. 2. Breathe deeply into a paper bag when nauseated. 3. Keep adhesive dressings in place for 6 weeks. 4. Report bile-colored drainage from any incision. The correct answer is 4. Report bile-colored drainage from any incision. There should be no bile-colored drainage coming from any of the incisions post-operatively. A laparoscopic cholecystectomy does not involve a bile bag. Breathing deeply into a paper bag will prevent a person from passing out due to hyperventilation. It does not alleviate nausea. If the adhesive dressings have not already fallen off, they are removed by the surgeon in 7 to 10 days, not 6 weeks. A client is admitted with acute necrotizing pancreatitis. Lab results have been obtained, and a peripheral IV has been inserted. Which of the following prescriptions from a healthcare provider should the nurse question? 1. Infuse a 500 ml normal saline bolus. 2. Calcium gluconate 90 mg in 100 ml normal saline. 3. Total parenteral nutrition at 72 ml per hour. 4. Placement of a Foley catheter. The correct answer is 3. Total parenteral nutrition at 72 ml per hour. Clients with acute necrotizing pancreatitis should remain nothing by mouth with early enteral feeding via the jejunum to maintain bowel integrity and immune function. TPN is considered if enteral feedings are contraindicated. Access is also needed for TPN, preferably via a central line. Hemodynamic instability can result from fluid volume loss and bleeding and requires fluid and electrolyte replacement. Fat necrosis occurring with acute pancreatitis can cause hypocalcemia requiring calcium replacement. A Foley catheter provides accurate output assessment to monitor for prerenal acute renal failure that can occur from hypovolemia. The nurse monitors the client with pancreatitis for early signs of shock. Which of the following conditions is primarily responsible for making it difficult to manage shock in pancreatitis? 1. Severity of intestinal hemorrhage. 2. Vasodilating effects of kinin peptides. 3. Tendency toward heart failure. 4. Frequent incidence of acute tubular necrosis. The correct answer is 2. Vasodilating effects of kinin peptides. Life-threatening shock is a potential complication of pancreatitis. Kinin peptides activated by the trap trypsin cause vasodilation and increased capillary permeability. These effects exacerbate shock and are not easily reversed with pharmacologic agents such as vasopressors. Hemorrhage may occur into the pancreas, but not in the intestines. Systemic complications include pulmonary complications, but not heart failure or acute tubular necrosis. The nurse is monitoring a client admitted with a myocardial infarction who is at risk for cardiogenic shock. The nurse should report which of the following changes on the client's chart to the physician? 1. Urine output. 2. Heart rate. 3. Blood pressure. 4. Respiratory rate. The correct answer is 1. Urine output. Oliguria occurs during cardiogenic shock because there is reduced blood flow to the kidneys. Typical signs of cardiogenic shock include low blood pressure, rapid and weak pulse, decreased urine output, and signs of diminished blood flow to the brain, such as confusion and restlessness. Cardiogenic shock is a serious complication of MI, with a mortality rate approaching 90%. Fever is not a typical sign of cardiogenic shock. The other changes in vital signs on the client's chart are not as significant as the decreased urinary output. A client has been admitted to the medical surgical unit following an emergency cholecystectomy. There is a Jackson-Pratt drain with a portable suction unit attached. After 4 hours, the drainage unit is full. The nurse should do which of the following? 1. Notify the surgeon. 2. Remove the drain and suction unit. 3. Check the dressing for bleeding. 4. Empty the drainage unit. The correct answer is 4. Empty the drainage unit. Portable suction units should be emptied and drained every shift or when full. It is normal for the unit to fill within the first hours after surgery. The nurse does not need to contact the surgeon. There should not be bleeding on the dressing if the drainage system is emptied when full. The drain should not be removed until prescribed by the physician. Which of the following discharge instructions would be appropriate for a client who has had a laparoscopic cholecystectomy and has sutures covered by steri-strips? 1. Avoid showering for 1 week after surgery. 2. Return to work within 1 week. 3. Leave steri-strips in place until you see the surgeon at the post-operative visit. 4. Use acetaminophen to control any fever. The correct answer is 3. Leave steri-strips in place until you see the surgeon at the post-operative visit. After a laparoscopic cholecystectomy, when there are sutures covered by a dressing or steri-strips, the client should not remove dressings from the puncture sites, but should wait until visiting the surgeon. The client may shower 48 hours after surgery. A client can return to work within 1 week, but only if approved by the surgeon and no strenuous activity is involved. The client should report any fever, which could be an indication of a complication. The nurse prepares to administer promethazine 35 mg IM as prescribed PRN for a client with cholecystitis who has nausea. The ampule label reads that the medication is available in 25 mg per ml. How many milliliters should the nurse administer? To solve this problem, you set up the formula as 35 milligrams over X equals to 25 milligrams over 1 milliliter. You cross-multiply 35 times 1 and X times 25. You get 25X equals to 35. You divide 25 on both sides, and you get X equals to 1.4 milliliters. After a cholecystectomy, the client is to follow a low-fat diet. Which of the following foods would be most appropriate to include in a low-fat diet? 1. Cheese omelet. 2. Peanut butter. 3. Ham salad sandwich. 4. Roast beef. The correct answer is 4. Roast beef. Lean meats, such as beef, lamb, veal, and well-trimmed lean ham and pork, are low in fat. Rice, pasta, and vegetables are low in fat when not served with butter, cream, or sauces. Fruits are low in fat. The amount of fat allowed in a client's diet after a cholecystectomy will depend on the client's ability to tolerate fat. Typically, the client does not require a special diet, but is encouraged to avoid excessive fat intake. A cheese omelet and peanut butter have high fat content. Ham salad is high in fat from the fat in salad dressing. The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm shown on the electrocardiogram strip below. The nurse identifies this rhythm as 1. Atrial fibrillation. 2. Ventricular tachycardia. 3. Premature ventricular contractions. 4. Sinus tachycardia. The correct answer is 4. Sinus tachycardia. Sinus tachycardia is characterized by normal conduction and a regular rhythm, but with a rate exceeding 100 beats per minute. A P wave precedes each QRS, and the QRS is usually normal. The nurse measures the amount of bile drainage from a T-tube and records it by which one of the following methods? 1. Adding it to the client's urine output. 2. Charting it separately on the output record. 3. Adding it to the amount of wound drainage. 4. Subtracting it from the total intake for each day. The correct answer is 2. Charting it separately on the output record. T-tube bile drainage is recorded separately on the output record. Adding the T-tube drainage to the urine output or wound drainage makes it difficult to accurately determine the amounts of bile, urine, or drainage. The client's total intake will be incorrect if drainage is subtracted from it. A client has an open cholecystectomy with bile duct exploration. Following surgery, the client has a T-tube. To evaluate the effectiveness of the T-tube, the nurse should 1. Irrigate the tube with 20 ml of normal saline every 4 hours. 2. Unclamp the T-tube and empty the contents every day. 3. Assess the color and amount of drainage every shift. 4. Monitor the multiple incision sites for bile drainage. The correct answer is 3. Assess the color and amount of drainage every shift. A T-tube is inserted in the common bile duct to maintain patency until edema from the duct exploration subsides. The bile color should be gold to dark green, and the amount of drainage should be closely monitored to ensure tube patency. Irrigation is not routinely done unless prescribed using a smaller volume of fluid. The T-tube is not clamped in the early post-op period to allow for continuous drainage. An open cholecystectomy has one right subcostal incision, whereas a laparoscopic cholecystectomy has multiple small incisions. A client's stools are light gray in color. The nurse should assess the client further for which of the following? Select all that apply. 1. Intolerance to fatty foods. 2. Fever. 3. Jaundice. 4. Respiratory distress. 5. Pain at McBurney's point. 6. Peptic ulcer disease. The correct answers: 1. Intolerance to fatty foods. 2. Fever. And 3. Jaundice. Bile is created in the liver, stored in the gallbladder, and released into the duodenum, giving stool its brown color. A bile duct obstruction can cause pale-colored stools. Other symptoms associated with cholelithiasis are right upper quadrant tenderness, fever from inflammation or infection, jaundice from elevated serum bilirubin levels, and nausea or right upper quadrant pain after a fatty meal. Pain at McBurney's point lies between the umbilicus and right iliac crest and is associated with appendicitis. A bleeding ulcer produces black, tarry stools. Respiratory distress is not a symptom of cholelithiasis. A 40-year-old client is admitted to the hospital with a diagnosis of acute cholecystitis. The nurse should contact the physician to question which of the following prescriptions. 1. IV fluid therapy of normal saline solution to be infused at 100 ml per hour until further prescriptions. 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. 3. Nothing by mouth until further prescriptions. 4. Insert a nasogastric tube and connect to low intermittent suction. The correct answer is 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. A nurse should question the prescription for morphine sulfate because it is believed to cause biliary spasm. Thus, the preferred opioid analgesic to treat cholecystitis is meperidine. Elderly clients should not be given meperidine because of the risk of acute confusion and seizures in this population. An alternative pain medication will be necessary. IV fluid therapy is used to maintain fluid and electrolyte balance that may result from NPO status and gastric suctioning. NPO status and gastric decompression prevent further gallbladder stimulation. A client is to have a Schilling test. The nurse should 1. Administer methylcellulose. 2. Start a 24 to 48-hour urine specimen collection. 3. Maintain nothing by mouth status. 4. Start a 72-hour stool specimen collection. The correct answer is 2. Start a 24 to 48-hour urine specimen collection. Urinary vitamin B12 levels are measured after the ingestion of radioactive vitamin B12. A 24 to 48-hour urine specimen is collected after administration of an oral dose of radioactively tagged vitamin B12 and an injection of non-radioactive vitamin B12. In a healthy state of absorption, excess vitamin B12 is excreted in the urine. In a malabsorptive state, or when the intrinsic factor is missing, vitamin B12 is excreted in the feces. Methylcellulose is a bulk-forming agent. Laxatives interfere with the absorption of vitamin B12. The client is NPO 8 to 12 hours before the test, but is not NPO during the test. A stool collection is not a part of the Schilling test. If stool contaminates the urine collection, the results will be altered. A client has fatigue, temperature of 37.5 degrees Celsius, dark bronze skin, and dark urine. Hemoglobin is 9 grams per deciliter. Hematocrit is 49, and red blood cells are 2.75 million per microliter. What should the nurse do first? 1. Initiate an intake and output record. 2. Place the client on bed rest. 3. Place the client on contact isolation. 4. Keep the client out of sunlight. The correct answer is 1. Initiate an intake and output record. The nurse should prepare to start an intake and output record because the client is exhibiting clinical manifestations of anemia with jaundice and is demonstrating a fluid imbalance. The client does not need to be on bed rest at this point. The client is not contagious and does not need to be placed in contact isolation. The changes in the color of the skin and urine are related to the jaundice and will not be affected by sunlight. Which position would most help to decrease a client's discomfort when the client's spouse injects vitamin B12 using the ventrogluteal site? 1. Lying on the side with legs extended. 2. Lying on the abdomen with toes pointed inward. 3. Leaning over the edge of a low table with hips flexed. 4. Standing upright with the feet 1 shoulder width apart. The correct answer is 2. Lying on the abdomen with toes pointed inward. To promote comfort when injecting at the ventrogluteal site, the position of choice is with the client lying on the abdomen with toes pointed inward. This positioning promotes muscle relaxation, which decreases the discomfort of making an injection into a tense muscle. Lying on the side with legs extended will not provide the greatest muscle relaxation. Leaning over the edge of a table with the hips flexed and standing upright with the feet apart will increase muscular tension. A client was admitted to the hospital with iron deficiency anemia and blood-streaked emesis. Which question is most appropriate for the nurse to ask in determining the extent of the client's activity intolerance? 1. What daily activities were you able to do 6 months ago compared with the present? 2. How long have you had this problem? 3. Have you been able to keep up with all your usual activities? 4. Are you more tired now than you used to be? The correct answer is 1. What daily activities were you able to do 6 months ago compared with the present? It is difficult to determine activity intolerance without objectively comparing activities from one time frame to another. Because iron deficiency anemia can occur gradually and individual endurance varies, the nurse can best assess the client's activity tolerance by asking the client to compare activities 6 months ago and at present. Asking a client how long a problem has existed is a very open-ended question that allows for too much subjectivity for any definition of the client's activity tolerance. Also, the client may not even identify that a problem exists. Asking the client whether he is staying abreast of usual activities addresses whether the tasks were completed, not the tolerance of the client while the tasks were being completed, or the resulting condition of the client after the tasks were completed. Asking the client if he is more tired now than usual does not address his activity tolerance. Tiredness is a subjective evaluation and again can be distorted by factors such as the gradual onset of the anemia or the endurance of the individual. A client had a resection of the terminal ileum 3 years ago. While obtaining a health history and physical assessment, the nurse finds that the client has weakness, shortness of breath, and a sore tongue. Which additional information from the client indicates a need for intervention and client teaching? 1. I have been drinking plenty of fluids. 2. I have been gargling with warm salt water for my sore tongue. 3. I have 3 to 4 loose stools per day. 4. I take a vitamin B12 tablet every day. The correct answer is 4. I take a vitamin B12 tablet every day. Vitamin B12 combines with intrinsic factor in the stomach and is then carried to the ileum, where it is absorbed into the bloodstream. In this situation, vitamin B12 cannot be absorbed regardless of the amount of oral intake of sources of vitamin B12, such as animal protein or vitamin B12 tablets. Vitamin B12 needs to be injected every month because the ileum has been surgically removed. Replacement of fluids and electrolytes is important when the client has continuous multiple loose stools on a daily basis. Warm salt water is used to soothe sore mucous membranes. Crohn's disease and a small bowel resection may cause several loose stools a day. Which of the following lab values should the nurse report to the healthcare provider when the client has anemia? 1. Schilling test result, elevated. 2. Intrinsic factor, absent. 3. Sedimentation rate, 16 millimeters per hour. 4. Red blood cells within normal range. The correct answer is 2. Intrinsic factor, absent. The defining characteristic of pernicious anemia, a megaloblastic anemia, is lack of the intrinsic factor, which results from atrophy of the stomach wall. Without the intrinsic factor, vitamin B12 cannot be absorbed in the small intestine, and folic acid needs vitamin B12 for deoxyribonucleic acid synthesis of RBCs. The gastric analysis is done to determine the primary cause of the anemia. An elevated excretion of the injected radioactive vitamin B12, which is protocol for the first and second stages of the Schilling test, indicates that the client has the intrinsic factor and can absorb vitamin B12 in the intestinal tract. A sedimentation rate of 16 millimeters per hour is normal for both men and women and is a non-specific test to detect the presence of inflammation. It is not specific to anemias. An RBC value within the normal range does not indicate an anemia. The nurse should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? 1. Whole grains. 2. Green leafy vegetables. 3. Meats and dairy products. 4. Broccoli and Brussels sprouts. The correct answer is 3. Meats and dairy products. Good sources of vitamin B12 include meats and dairy products. Whole grains are a good source of thiamine. Green leafy vegetables are good sources of niacin, folate, and carotenoids, which are precursors of vitamin A. Broccoli and Brussels sprouts are good sources of ascorbic acid, which is vitamin C. A client has been admitted with active rectal bleeding and has been typed and cross-matched for 2 units of packed red blood cells. Within 10 minutes of admission, the client faints when getting up to go to the bedside commode. The nurse notifies the healthcare provider, who prescribes a unit of blood to be administered immediately. The nurse can safely administer which type of blood for immediate transfusion? 1. A negative. 2. B negative. 3. AB negative. 4. O negative. The correct answer is 4. O negative. A routine serology study to confirm compatibility between a blood donor and recipient takes about 1 hour. In an emergency, O negative RBCs can be safely administered to most clients, which is why a person with O negative blood is called a universal donor. The other types of RBCs may cause an adverse reaction. A client had a mastectomy followed by chemotherapy 6 months ago. She reports that she is now unable to concentrate at her card game, and it seems harder and harder to finish her errands because of exhaustion. Based on this information, the nurse should suggest that the client do which of the following? 1. Take frequent naps. 2. Limit activities. 3. Increase fluid intake. 4. Avoid contact with others. The correct answer is 1. Take frequent naps. This client is likely experiencing fatigue and should increase her periods of rest. The fatigue may be caused by anemia from depletion of red blood cells due to the chemotherapy. Asking the client to limit her activities may cause the client to become withdrawn. The information given does not support limiting activity. Increasing fluid intake will not reduce the fatigue. The information does not indicate that the client is immunosuppressed and should avoid contact with others. The nurse is assisting with a bone marrow aspiration and biopsy. In which order, from first to last, should the nurse complete the following tasks? 1. Position the client in a side-lying position. 2. Clean the skin with an antiseptic solution. 3. Verify the client has signed an informed consent. 4. Apply ice to the biopsy site. The correct order is 3. Verify the client has signed an informed consent. 1. Position the client in a side-lying position. 2. Clean the skin with an antiseptic solution. And 4. Apply ice to the biopsy site. First, the nurse must verify that the client has voluntarily signed a consent form before the procedure begins, and check that the client understands the procedure. The nurse then positions the client in a side-lying or lateral decubitus, position with the affected side up. Then the nurse should clean the skin site and surrounding area with an antiseptic solution, such as betadine, before the healthcare provider numbs the site and collects the specimen. When the procedure is finished, the nurse must apply ice to the biopsy site to reduce pain. A client from a Mediterranean country is admitted with thalassemia, jaundice, splenomegaly, and hepatomegaly. Which of the following should be the primary focus of nursing care for this client? 1. Providing activities of daily living on the time schedule of the client's homeland. 2. Offering foods that the client enjoys in order to increase the intake of calories. 3. Decreasing cardiac demands by promoting rest. 4. Listening to concerns about the hospitalization. The correct answer is 3. Decreasing cardiac demands by promoting rest. This client has clinical manifestations of thalassemia major, a disease found in descendants from the Mediterranean Sea area whose mother and father both possess a gene for thalassemia. The severe hemolytic anemia causes sequestration of red blood cells in the spleen and liver, which leads to engorgement of the organs and chronic bone marrow hyperplasia. Rest will decrease the demands on the heart due to the diminished hemoglobin level, a physiologic concern. The nurse should follow the time schedule of the area in which the client is now living. The nurse can help the client prescribe preferred foods and listen to concerns, but the main priority is to decrease oxygen demands. When a client is receiving a cephalosporin, the nurse must monitor the client for which of the following? 1. Drug-induced hemolytic anemia. 2. Purpura. 3. Infectious emboli. 4. Ecchymosis. The correct answer is 1. Drug-induced hemolytic anemia. Drug-induced hemolytic anemia is acquired, antibody-mediated, RBC destruction precipitated by medications such as cephalosporins, sulfa drugs, rifampin, methyldopa, procainamide, quinidine, and thiazide. Purpura is a condition with various manifestations characterized by hemorrhages into the skin, mucous membranes, internal organs, and other tissues. Infectious emboli are clumps of bacteria present in blood or lymph. Ecchymoses are skin discolorations due to extravasations of blood into the skin or mucous membranes. A client is admitted from the emergency department after falling down a flight of stairs at home. The client's vital signs are stable, and the history states that the client had a gastric stapling 2 years ago. The client jokes about being clumsy lately and tripping over things. The nurse should ask the client which of the following questions? Select all that apply. 1. Are you experiencing numbness in your extremities? 2. How much vitamin B12 are you getting? 3. Are you feeling depressed? 4. Do you feel safe at home? 5. Are you getting sufficient iron in your diet? The correct answers are 1. Are you experiencing numbness in your extremities? 2. How much vitamin B12 are you getting? 3. Are you feeling depressed? And 4. Do you feel safe at home? The nurse should ask the client about symptoms related to pernicious anemia because the client had the stomach stapled 2 years ago and shows no history of supplemental vitamin B12. Numbness and tingling relate to a loss of intrinsic factor from the gastric stapling. Intrinsic factor is necessary for absorption of vitamin B12. The nurse should suspect pernicious anemia if the client is not taking supplemental vitamin B12. Other signs and symptoms of pernicious anemia include cognitive problems and depression. The nurse also should ask about the client's support at home in case the fall was not an accident. Pernicious anemia is not related to dietary intake of iron. A physician prescribes vitamin B12 for a client with pernicious anemia. Which sites are appropriate for the nurse to administer vitamin B12? Select all that apply. 1. Median cutaneous. 2. Greater femur trochanter. 3. Acromion muscle. 4. Ventrogluteal. 5. Upper back. 6. Dorsogluteal. The correct answers are 4. Ventrogluteal and 6. Dorsogluteal. A client with pernicious anemia has lost the ability to absorb vitamin B12 either because of the lack of an acidic gastric environment or the lack of the intrinsic factor. Vitamin B12 must be administered by a deep intramuscular route. The ventrogluteal and dorsogluteal locations are the most acceptable sites for a deep intramuscular injection. The other sites are not acceptable. A client who follows a vegetarian diet was referred to a dietitian for nutritional counseling for anemia. Which client outcome indicates that the client does not understand nutritional counseling? The client. 1. Adds dried fruit to cereal and baked goods. 2. Cooks tomato-based foods in iron pots. 3. Drinks coffee or tea with meals. 4. Adds vitamin C to all meals. The correct answer is 3. Drinks coffee or tea with meals. Coffee and tea increase gastrointestinal motility and inhibit the absorption of non-heme iron. Clients are instructed to add dried fruits to dishes at every meal because dried fruits are a non-heme or non-animal iron source. Cooking in iron cookware, especially acid-based foods such as tomatoes, adds iron to the diet. Clients are instructed to add a rich supply of vitamin C to every meal because the absorption of iron is increased when food with vitamin C or ascorbic acid is consumed. The nurse devises a teaching plan for the client with aplastic anemia. Which of the following is the most important concept to teach for health promotion and maintenance? 1. Eat animal protein and dark green, leafy vegetables every day. 2. Avoid exposure to others with acute infections. 3. Practice yoga and meditation to decrease stress and anxiety. 4. Get 8 hours of sleep at night and take naps during the day. The correct answer is 2. Avoid exposure to others with acute infections. Clients with aplastic anemia are severely immunocompromised and at risk for infection and possible death related to bone marrow suppression and pancytopenia. Strict aseptic technique and reverse isolation are important measures to prevent infection. Although diet, reduced stress, and rest are valued in supporting health, the potentially fatal consequence of an acute infection places it as a priority for teaching the client about health maintenance. Animal meat and dark green leafy vegetables, good sources of vitamin B12 and folic acid, should be included in the daily diet. Yoga and meditation are good complementary therapies to reduce stress. 8 hours of rest and naps are good for spacing and pacing activity and rest. The nurse has just admitted a 35-year-old female client who has a serum vitamin B12 concentration of 800 picograms per milliliter. Which of the following laboratory findings should alert the nurse to focus the health history to obtain specific information about drug or alcohol use? 1. Total bilirubin, 0.3 milligrams per deciliter. 2. Serum creatinine, 0.5 milligrams per deciliter. 3. Hemoglobin, 16 grams per deciliter. 4. Folate, 1.5 nanograms per milliliter. The correct answer is 4. Folate, 1.5 nanograms per milliliter. Normal range of folic acid is 1.8 to 9 nanograms per milliliter, and normal range of vitamin B12 is 200 to 900 picograms per milliliter. A low folic acid level in the presence of a normal vitamin B12 level is indicative of a primary folic acid deficiency anemia. Factors that affect the absorption of folic acid are drugs such as methotrexate, oral contraceptives, anti-seizure drugs, and alcohol. The total bilirubin, serum creatinine, and hemoglobin values are within normal limits. The nurse is preparing to teach a client with microcytic hypochromic anemia about the diet to follow after discharge. Which of the following foods should be included in the diet? 1. Eggs. 2. Lettuce. 3. Citrus fruits. 4. Cheese. The correct answer is 1. Eggs. One of the microcytic hypochromic anemias is iron deficiency anemia. A rich source of iron is needed in the diet, and eggs are high in iron. Other foods high in iron include organ and muscle meats, shellfish, shrimp, and tuna. Enriched, whole grain, and fortified cereals and breads, legumes, nuts, dried fruits and beans, oatmeal, and sweet potatoes. Dark green, leafy vegetables and citrus fruits are good sources of vitamin C. Cheese is a good source of calcium. A client is to have a transfusion of packed red blood cells from a designated donor. The client asks if any diseases can be transmitted by this donor. The nurse should inform the client that which of the following diseases can be transmitted by a designated donor? Select all that apply. 1. Epstein-Barr virus. 2. Human immunodeficiency virus. 3. Cytomegalovirus. 4. Hepatitis A. 5. Malaria. The correct answers are 1. Epstein-Barr virus, 2. Human immunodeficiency virus, and 3. Cytomegalovirus. Using designated donors does not decrease the risk of contracting infectious diseases, such as the Epstein-Barr virus, HIV, or CMV. Hepatitis A is transmitted by the oral fecal route, not the blood route. However, hepatitis B and C can be contracted from a designated donor. Malaria is transmitted by mosquitoes. A client with iron deficiency anemia is refusing to take the prescribed oral iron medication because the medication is causing nausea. The nurse should do which of the following? Select all that apply. 1. Suggest that the client use ginger when taking the medication. 2. Ask the client what is causing the nausea. 3. Tell the client to use stool softeners to minimize constipation. 4. Offer to administer the medication by an intramuscular injection. 5. Suggest that the client take the iron with orange juice. The correct answers are 1. Suggest that the client use ginger when taking the medication. 2. Ask the client what is causing the nausea. And 5. Suggest that the client take the iron with orange juice. Nausea and vomiting are common adverse effects of oral iron preparations. The nurse should first ask the client why the client does not want to take the oral medication, and then suggest ways to decrease the nausea and vomiting. Ginger may help minimize the nausea, and the client can try this remedy and evaluate its effectiveness. Iron should be taken on an empty stomach, but can be taken with orange juice. The client can evaluate if this helps the nausea. Stool softeners should not be used in clients with iron deficiency anemia. Instead, constipation can be prevented by following a high-fiber diet. Administering iron intramuscularly is done only if other approaches are not effective.
The nurse is receiving a patient with peripheral vascular disease from the post-anesthesia care unit after a SIME amputation of the right lower extremity. At which level on this diagram would the nurse expect to find the amputation? 1A, 2B, 3C, 4D. The correct answer is 3C. Rationale. When a patient has a SIME amputation, most of the foot is removed but the ankle remains. Advantages of this surgery over below the knee include that the patient can still be weight-bearing and that there is less pain. The nurse is preparing a patient for magnetic resonance imaging. Which action can the nurse delegate to the experienced assistive personnel? 1. Teach the patient what to expect during the test. 2. Instruct the patient to remove metal objects, including zippers. 3. Witness that the patient has signed a consent form. 4. Check and record pre-procedure vital signs. The correct answer is 4. Check and record pre-procedure vital signs. Rationale. The AP scope of practice includes checking and recording patient vital signs. Teaching and instructing, as well as witnessing consent forms, is appropriate to the professional nurse's scope of practice. The AP could remind the patient about the removal of metal objects after the patient receives that instruction. The emergency department nurse should question which healthcare provider prescription when providing care for an older adult with a fracture of the left ulna. 1. Get x-rays of the left forearm. 2. Give him a Paradine IM for pain. 3. Monitor vital signs every hour. 4. Elevate left arm on pillows. The correct answer is 2. Give meperidine IM for pain. Meperidine should not be used because of its toxic metabolites that can cause seizures and other adverse drug events, especially in the older adult population. X-rays are used to confirm the diagnosis. Vital signs and elevation are common actions for a patient in the emergency department, and elevation can decrease the swelling in the affected extremity. A patient who underwent a right above the knee amputation 4 days ago also has a diagnosis of depression. Which prescription would the nurse clarify with the healthcare provider? 1. Give fluoxetine 40 milligrams once a day. 2. Administer acetaminophen with codeine 1 or 2 tablets every 4 hours as needed. 3. Assist a patient to the bedside chair every shift. 4. Reinforce the dressing to the right residual limb as needed. The correct answer is 1. Give fluoxetine 40 milligrams once a day. Rationale. Doses of fluoxetine, a drug used to treat depression, that are greater than 20 milligrams should be given in 2 divided doses, not once a day. The other 3 prescriptions are appropriate for a patient who underwent amputation 4 days earlier. During morning care, a patient with a below-the-knee amputation asked the assistive personnel about prostheses. How will the nurse instruct the AP to respond? 1. You should get a prosthesis so that you can walk again. 2. Wait and ask your healthcare provider that question the next time he comes in. 3. It's too soon to be worrying about getting a prosthesis. 4. I'll ask the nurse to come in and discuss this with you. The correct answer is 4. I'll ask the nurse to come in and discuss this with you. Rationale. The patient is indicating an interest in learning about prostheses. The experienced nurse can initiate discussion and begin educating the patient. Certainly, the HCP can also discuss prostheses with the patient, but the patient's wish to learn should receive a quick response. The nurse can then notify the HCP about the patient's request. The charge nurse is assigning the nursing care of a patient who had a left below-the-knee amputation 1 day ago to an experienced nurse who will function under the lead nurse's supervision. What will the lead nurse tell the experienced nurse is a major focus for the patient's care today? 1. To attain pain control over phantom pain. 2. To monitor for signs of sufficient tissue perfusion. 3. To assist the patient to ambulate as soon as possible. 4. To elevate the residual limb when the patient is supine. The correct answer is 2. To monitor for signs of sufficient tissue perfusion. Rationale. Monitoring for sufficient tissue perfusion is a priority at this time. Phantom pain is a concern, but is more common in patients with above-the-knee amputations. Early ambulation is a goal, but at this time, the patient is more likely to be engaged in muscle-strengthening exercises. Elevating the residual limb on a pillow is controversial because it may promote knee flexion contracture. A patient with a fractured fibula is receiving skeletal traction and has skeletal pins in place. What would the nurse instruct the assistive personnel to report immediately? 1. The patient wants to change position in bed. 2. There is a small amount of clear fluid at the pin sites. 3. The traction weights are resting on the floor. 4. The patient reports pain and muscle spasm. The correct answer is 3. The traction weights are resting on the floor. Rationale. When the weights are resting on the floor, they are not exerting pulling force to provide reduction and alignment or to prevent muscle spasm. The weights should always hang freely. Attending the weights may reduce the patient's pain and spasms. With skeletal pins, a small amount of clear fluid drainage is expected. It is important to inspect the traction system after a patient changes position because position changes may alter the traction. A patient has a fractured femur, which finding would the nurse instruct the assistive personnel to report immediately? 1. The patient reports pain. 2. The patient appears confused. 3. The patient's blood pressure is 136/88. 4. The patient voided using the bedpan. The correct answer is 2. The patient appears confused. Rationale. Fat embolism syndrome is a serious complication that often results from fractures of long bones. Its earliest manifestation is altered mental status caused by a low arterial oxygen level. The nurse would want to know about and treat the pain, but it is not life-threatening. The nurse would also want to know about the blood pressure in the patient's voiding. However, this information is not urgent to report. The emergency department nurse receives a call about a patient with a traumatic finger amputation. What instructions will the nurse provide to the patient's wife? Select all that apply. 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 3. Place the bag directly on ice. 4. Elevate the affected extremity above the patient's heart. 5. Examine the amputation site and apply direct pressure with layers of dry gauze. 6. After performing these steps, call 911 and check the patient for breathing. The correct answers are 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 4. Elevate the affected extremity above the patient's heart. And 5. Examine the amputation site and apply direct pressure with layers of dry gauze. Rationale. For a person who has a traumatic amputation in the community, first call 911 and then assess the patient for airway or breathing problems. Examine the amputation site and apply direct pressure with layers of dry gauze or cloth. Elevate the extremity above the patient's heart to decrease the bleeding. Do not remove the dressing to prevent dislodging the clot. Wrap the completely severed finger in dry sterile gauze or a clean cloth. Put the finger in a watertight, sealed plastic bag. Place the bag in ice water, never directly on ice, with 1 part ice and 3 parts water. Avoid contact between the finger and the water to prevent tissue damage. Do not remove any semi-detached parts of the digit. Be sure that the part goes with the patient to the hospital. The nurse is preparing a patient who had carpal tunnel release surgery for discharge. Which information is important to provide for this patient? 1. The surgical procedure is a cure for carpal tunnel syndrome. 2. Do not lift any heavy objects. 3. Frequent doses of pain medication will no longer be necessary. 4. The healthcare provider should be notified immediately if there is any pain or discomfort. The correct answer is 2. Do not lift any heavy objects. Rationale. Hand movements, including heavy lifting, may be restricted for 4 to 6 weeks after surgery. Patients experience discomfort for weeks to months after surgery. The surgery is not always a cure. In some cases, CTS may recur months to years after surgery. A patient is scheduled for endoscopic carpal tunnel release surgery in the morning. What would the nurse be sure to teach the patient? 1. Pain and numbness are expected to be experienced for several days to weeks. 2. Immediately after surgery, the patient will no longer need assistance. 3. After surgery, the dressing will be large and there will be lots of drainage. 4. The patient's pain and paresthesia will no longer be present. The correct answer is 1. Pain and numbness are expected to be experienced for several days to weeks. Rationale. Postoperative pain and numbness occur for a longer period of time with endoscopic carpal tunnel release than with an open procedure. Patients often need assistance post-operatively, even after they are discharged. The dressing from the endoscopic procedure is usually very small, and there should not be a lot of drainage. The nurse is caring for a patient with carpal tunnel syndrome who has been admitted for surgery. Which intervention should be delegated to the assistive personnel? 1. Initiating placement of a splint for immobilization during the day. 2. Assessing the patient's wrist and hand for discoloration and brittle nails. 3. Assisting the patient with daily self-care measures, such as bathing and eating. 4. Testing the patient for painful tingling in the 5 digits of the hand. The correct answer is 3. Assisting the patient with daily self-care measures, such as bathing and eating. Rationale: helping with activities of daily living is within the scope of practice of APs. Placing a splint for the first time is appropriate to the scope of practice of physical therapists. Assessing and testing for paresthesia are not within the scope of practice of APs and are appropriate for professional nurses. The nurse delegates the measurement of vital signs to an experienced assistive personnel. Osteomyelitis has been diagnosed in a patient. Which vital sign value would the nurse instruct the AP to report immediately for this patient? 1. Temperature of 101 degrees Fahrenheit. 2. Blood pressure of 136/80. 3. Heart rate of 96 beats per minute. 4. Respiratory rate of 24 breaths per minute. The correct answer is 1. Temperature of 101 degrees Fahrenheit. Rationale: an elevated temperature indicates infection and inflammation. This patient needs IV antibiotic therapy. The other vital sign values are normal or high normal. The charge nurse observes an LPN/LVN assigned to provide all of these interventions for a patient with Paget disease. Which action requires that the charge nurse intervene? 1. Administering 600 milligrams of ibuprofen to the patient. 2. Encouraging the patient to perform exercises recommended by a physical therapist. 3. Applying ice and gentle massage to the patient's lower extremities. 4. Reminding the patient to drink milk and eat cottage cheese. The correct answer is 3. Applying ice and gentle massage to the patient's lower extremities. Rationale: applying heat, not ice, is the appropriate measure to help reduce the patient's pain. Ibuprofen is useful to manage mild to moderate pain. Exercise prescribed by a physical therapist would be non-impact in nature and provide strengthening for the patient. A diet rich in calcium promotes bone health. The nurse is preparing to teach a patient with a new diagnosis of osteoporosis about strategies to prevent falls. Which teaching points should the nurse be sure to include? Select all that apply. 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. 4. Expect a few bumps and bruises when you go home. 5. Rest when you are tired. 6. Avoid consuming 3 or more alcoholic drinks per day. The correct answers are 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. And 5. Rest when you are tired. Rationale: the purpose of this teaching is to help the patient prevent falls. The hip protector can prevent hip fractures if the patient falls. Throw rugs and obstacles in the home increase the risk of falls. Patients who are tired are also more likely to fall. Exercise helps to strengthen muscles and improve coordination. Women should not consume more than 1 drink per day, and men should not consume more than 2 drinks per day. The nurse is preparing a discussion of musculoskeletal health maintenance for a group of older adults. Which key points would the nurse be sure to include? Select all that apply. 1. Be aware of and consume foods rich in calcium and vitamin D. 2. Wear hats and long sleeves to avoid sun exposure at all times. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. 6. Weight-bearing activities decrease the risk for osteoporosis. The correct answers are 1. Be aware of and consume foods rich in calcium and vitamin D. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. And 6. Weight-bearing activities decrease the risk for osteoporosis. Rationale: many health problems of the musculoskeletal system can be prevented through health promotion strategies and avoidance of risky lifestyle behaviors. Weight-bearing activities such as walking, can reduce risk factors for osteoporosis and maintain muscle strength. Young men are at the greatest risk for trauma related to motor vehicle crashes. Older adults are at the greatest risk for falls that result in fractures and soft tissue injury. High-impact sports, such as excessive jogging or running, can cause musculoskeletal injury to soft tissues and bone. Tobacco use slows the healing of musculoskeletal injuries. Excessive alcohol intake can decrease vitamins and nutrients a person needs for bone and muscle tissue growth. Hats and long sleeves are recommended to prevent sunburn, but the nurse would recommend 20 minutes of sun exposure several times a week for vitamin D, which contributes to bone health. The nurse is assisting with a student assessment screening of 6th graders at the local grade school. A student presents with a back and spine, as in the following illustration. What is the nurse's best interpretation of this finding? 1. Dupuytren contracture. 2. Cole's fracture. 3. Scoliosis. 4. Lordosis. The correct answer is 3. Scoliosis. Rationale. Scoliosis occurs when the vertebrae rotate and begin to compress. The spinal column moves into a lateral curve. On assessment, findings include asymmetry of hip and shoulder height with prominent thoracic ribs and scapula on one side. Dupuytren contracture is a hand deformity with slow progressive thickening of the palmar fascia, leading to flexion contracture of the 4th and 5th fingers. Cole's fracture occurs in the distal radius. Lordosis is a loss of lumbar curvature, sometimes called flat back, which may also be present with scoliosis. The nurse is providing care for a patient with a connective tissue disorder exacerbation for whom the healthcare provider has prescribed an IV dose of methylprednisolone 20 milligrams in 50 milliliters normal saline to be infused over 30 minutes. At what rate will the nurse set the IV infusion pump to administer this drug correctly? The correct answer is 100 milliliters per hour. Rationale. The formula is volume in ml multiplied by 60 divided by time in minutes. You multiply 50 times 60 and divide by 30 minutes. The end result is 100. The nurse is teaching an older patient about risks for fractures and osteoporosis. Which diagnostic test should the nurse teach about when the goal is to establish the patient's bone strength and determine if osteoporosis is present? 1. Computed tomography scan. 2. Magnetic resonance imaging scan. 3. Dual energy X-ray absorptiometry scan. 4. Joint X-rays. The correct answer, 3. Dual energy X-ray absorptiometry scan. Rationale. Testing bone density is the only way to know for sure whether or not a patient has osteoporosis. A diagnostic test commonly prescribed by healthcare providers is dual energy X-ray absorptiometry scan. This type of scan focuses on two main areas, the hip and the spine. The forearm can be tested, however, if the hip or spine cannot be tested. The other tests may be prescribed, but are not as commonly used to test bone strength. The nurse is mentoring a student nurse who is caring for a patient with carpal tunnel syndrome of the right hand with a neurovascular check ordered every 2 hours, for which action by the student nurse must the nurse intervene. 1. Student nurse checks the patient's radial pulse every 2 hours. 2. Student nurse checks for sensation in the patient's right hand. 3. Student nurse assesses color, temperature, and pain in right wrist and hand. 4. Student nurse instructs the patient to avoid movement because of the pain. The correct answer is 4. Student nurse instructs the patient to avoid movement because of the pain. Rationale. Performing complete neurovascular assessment includes palpation of pulses in the extremities below the level of injury and assessment of sensation, movement, color, temperature, and pain in the injured part. If pulses are not palpable, use of a Doppler helps find pulses in the extremities. After surgery, the patient should be given pain medication and encouraged to move the fingers frequently. Some hand movements, such as lifting heavy objects, may be restricted for 4 to 6 weeks after surgery. The nurse is caring for a postoperative patient with a hip replacement. Which patient care actions can be delegated to the experienced assistive personnel? Select all that apply. 1. Inspect heels and other bony prominences every 8 hours. 2. Turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. 4. Assess the patient's calf regions for redness and swelling. 5. Check vital signs and oxygen saturation via pulse oximetry. 6. Assess for pain and administer pain medication. The correct answers are 2. Turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. And 5. Check vital signs and oxygen saturation via pulse oximetry. Rationale. The AP scope of practice includes repositioning patients and checking vital signs, and an experienced AP would know how to check pulse oximetry and elevate the patient's heels off the bed. Assessing and inspecting patients is more appropriate to the educational level of the professional nurse. During the assessment of a patient with fractures of the medial ulna and radius, the nurse finds all of these data. Which assessment findings should the nurse report to the healthcare provider immediately? 1. The patient reports pressure and pain. 2. The cast is in place and is dry and intact. 3. The skin is pink and warm to the touch. 4. The patient can move all the fingers and the thumb. The correct answer is 1. The patient reports pressure and pain. Rationale. Pressure and pain may be caused by increased compartment pressure and can indicate the serious complication of acute compartment syndrome. This situation is urgent. If it is not treated, cyanosis, tingling, numbness, paresis, and severe pain can occur. The other findings are normal and should be documented in the patient's chart. A patient with a right above the knee amputation asks the nurse why he has phantom limb pain. What is the nurse's best response? 1. Phantom limb pain is not explained or predicted by any one theory. 2. Phantom limb pain occurs because your body thinks your leg is still present. 3. Phantom limb pain will not interfere with your activities of daily living. 4. Phantom limb pain is not real pain but is remembered pain. The correct answer is 1. Phantom limb pain is not explained or predicted by any one theory. Rationale. 3 theories are being researched with regard to phantom limb pain. The peripheral nervous system theory suggests that sensations remain as a result of the severing of peripheral nerves during the amputation. The central nervous system theory states that phantom limb pain results from a loss of inhibitory signals that were generated through afferent impulses from the amputated limb. The psychological theory helps predict and explain phantom limb pain because stress, anxiety, and depression often trigger or worsen a pain episode. The nurse is supervising a newly graduated nurse caring for a patient with a fracture of the right ankle who is at risk for complications of immobility. For which action should the supervising nurse intervene? 1. Encouraging the patient to go from a lying to a standing position. 2. Administering pain medication before the patient begins exercises. 3. Explaining to the patient and family the purpose of the exercise program. 4. Reminding the patient about the correct use of crutches. The correct answer is 1. Encouraging the patient to go from a lying to a standing position. Rationale. Moving directly from a lying to a standing position does not allow the patient to establish balance. The supervising nurse should instruct the newly graduated nurse about moving the patient from a lying position first, then to a sitting position, and finally to a standing position, which will allow the patient to establish balance before standing. Administering pain medication before the patient begins exercising decreases pain with exercise. Explanations about the purpose of the exercise program and proper use of crutches are appropriate interventions for this patient. After the nurse receives the change of shift report, which patient should be assessed first? 1. A 42-year-old patient with carpal tunnel syndrome who reports pain. 2. A 64-year-old patient with osteoporosis awaiting discharge. 3. A 28-year-old patient with a fracture who reports that the cast is tight. 4. A 56-year-old patient with a left leg amputation who reports phantom pain. The correct answer is 3. A 28-year-old patient with a fracture who reports that the cast is tight. Rationale. The patient with a tight cast is at risk for circulation impairment and peripheral nerve damage. Although all of the other patient's concerns are important and the nurse will want to see them as soon as possible, none of their complaints is urgent. The patient with the tight cast may have risk for injury to a limb, which is more urgent. When receiving discharge instructions, a patient with osteoporosis makes all of these statements. Which statement indicates to the nurse that the patient needs additional teaching? 1. I take my ibuprofen every morning as soon as I get up. 2. My daughter removed all of the throw rugs in my home. 3. My husband helps me every afternoon with range of motion exercises. 4. I rest in my reclining chair every day for at least an hour. The correct answer is 1. I take my ibuprofen every morning as soon as I get up. Rationale. Ibuprofen can cause abdominal discomfort or pain and ulceration of the gastrointestinal tract. In such cases, it should be taken with meals or milk. Removal of throw rugs helps prevent falls. Range of motion exercises and rest are important strategies for coping with osteoporosis. The nurse is providing care for a patient with a rotator cuff tear. What treatment does the nurse expect the healthcare provider will prescribe first for this patient? 1. arthroscopic repair of the rotator cuff tear. 2. Elimination of movements in the affected shoulder. 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. 4. Pendulum exercises that start slow and progress over 2 weeks. The correct answer is 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. Rationale. For the patient with a torn rotator cuff, the HCP usually treats the patient conservatively with NSAIDs, intermittent steroid injections, physical therapy, and activity limitations while the tear heals. Physical therapy treatments may include ultrasound, electrical stimulation, ice, and heat. The charge nurse assigns the nursing care of a patient who has just returned from open carpal tunnel release surgery to an experienced LPN/LVN. Which instructions would the charge nurse provide for the LPN/LVN? Select all that apply. 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. 4. The patient will no longer need pain medication. 5. Check the neurovascular status of the fingers every hour. 6. Instruct the patient to perform range of motion on the affected wrist. The correct answers are 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. And 5. Check the neurovascular status of the fingers every hour. Rationale. Post-operatively, patients undergoing open carpal tunnel release surgery experience pain and numbness, and their discomfort may last for weeks to months. Hand movements may be restricted for 4 to 6 weeks after surgery. All of the other directions are appropriate for the postoperative care of this patient. It is important to monitor for drainage, tightness, and neurovascular changes. Raising the hand and wrist above the heart reduces the swelling from surgery, and this is often done for several days. The nurse observes the assistive personnel performing all of these interventions for a patient with carpal tunnel syndrome, which action requires that the nurse intervene immediately. 1. Arranging the patient's lunch tray and cutting his meat. 2. Providing warm water and assisting the patient with his bath. 3. Replacing the patient's splint in hyperextension position. 4. Reminding the patient not to lift very heavy objects. The correct answer is 3. Replacing the patient's splint in hyperextension position. Rationale. When a patient with CTS has a splint to immobilize the wrist is placed either in the neutral position or in slight extension, not hyperextension. The other interventions are correct and are within the scope of practice of an AP. APs may remind patients about elements of their care plans that have already been taught, such as avoiding heavy lifting. The nurse is working with an assistive personnel to provide care for 6 patients. At the beginning of the shift, the nurse carefully tells the AP what patient interventions and tasks he or she is expected to perform. Which 4 C's guide the nurse's communication with the AP? Select all that apply. 1. Clear. 2. Comprehensive. 3. Concise. 4. Credible. 5. Correct. 6. Complete. The correct answers are 1. Clear, 3. Concise, 5. Correct, and 6. Complete. Rationale. Clear, concise, correct, and complete are the 4 C's of communication. Implementing the 4 C's of communication helps the nurse ensure that the AP understands what is being said, that the AP does not confuse the nurse's directions, that the directions comply with policies, procedures, job descriptions, and the law, and that the AP has all the information necessary to complete the tasks assigned. The charge nurse is making assignments for the day shift. Which patient should be assigned to the nurse who was floated from the post-anesthesia care unit for the day? 1. A 35-year-old patient with osteomyelitis who needs teaching before hyperbaric oxygen therapy. 2. A 62-year-old patient with osteomalacia who is being discharged to a long-term care facility. 3. A 68-year-old patient with osteoporosis given a new orthotic device whose knowledge of its use must be assessed. 4. A 72-year-old patient with Paget disease who has just returned from surgery for total knee replacement. The correct answer is 4. A 72-year-old patient with Paget disease who has just returned from surgery for total knee replacement. Rationale. The post-anesthesia care unit nurse is very familiar with the assessment skills necessary to monitor a patient who just underwent surgery. For the other patients, nurse is familiar with musculoskeletal system. Related nursing care are needed to provide teaching and assessment and prepare a report to the long-term care facility. The nurse's assessment reveals all of these data when a patient with Paget disease is admitted to the acute care unit. Which findings should the nurse notify the healthcare provider about first? 1. There is a bowing of both legs, and the knees are asymmetrical. 2. The base of the skull is invaginated platybasia. 3. The patient is only 5 feet tall and weighs 120 pounds. 4. The skull is soft, thick, and larger than normal. The correct answer is 2. The base of the skull is invaginated platybasia. Rationale: platybasia, basilar skull invagination, causes brainstem manifestations that threaten life. Patients with Paget disease are usually short and often have bowing of the long bones that results in asymmetrical knees or elbow deformities. The skull is typically soft, thick, and enlarged. The nurse is caring for a patient with osteoporosis who is at an increased risk for falls. Which intervention should the nurse delegate to the assistive personnel? 1. Identifying environmental factors that increase the risk for falls. 2. Monitoring gait, balance, and fatigue level with ambulation. 3. Collaborating with the physical therapist to provide the patient with a walker. 4. Assisting the patient with ambulation to the bathroom and in the halls. The correct answer is 4. Assisting the patient with ambulation to the bathroom and in the halls. Rationale: assisting with activities of daily living, including assisting with ambulation to the bathroom and in the halls, is within the scope of the AP's practice. The other 3 interventions require additional educational preparation and are within the scope of practice of licensed nurses. The nurse is caring for a patient who had a dual energy X-ray absorptiometry scan and is now prescribed calcium with vitamin D twice a day. The patient asked the nurse the purpose of this drug. What is the nurse's best response? Select all that apply. 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 2. When your vitamin D level is high, your bones release calcium to keep your blood calcium level in the normal range. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. 4. When blood calcium is normal, long bones are formed, increasing a person's height. 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. 6. You can also get extra vitamin D by increasing your intake of beef and pork sources. The correct answers are 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. And 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. Rationale: vitamin D and its metabolites are produced in the body and transported in the blood to promote the absorption of calcium and phosphorus from the small intestine. There is a relationship between calcium and phosphorus, so that if a patient's phosphorus level is higher than normal, the calcium level will drop and vice versa. A decrease in the body's vitamin D level can result in osteomalacia, softening a bone, in an adult. When serum calcium levels are lowered, parathyroid hormone secretion increases and stimulates bone to promote osteoclastic activity and release calcium to the blood. PTH reduces the renal excretion of calcium and facilitates its absorption from the intestine. Sources of vitamin D include sunlight, fatty fish, and vitamin D in rich foods. The patient has portal hypertension and hepatic encephalopathy secondary to liver disease and is being treated with lactulose. Which laboratory result will the nurse check first to see if the medication is having the desired effect? 1. White blood cell count. 2. Ammonia level. 3. Potassium level. 4. Platelet count. The correct answer is 2. Ammonia level. Rationale: the healthy liver breaks down ammonia, but in liver disease, the ammonia accumulates and serum levels increase. Lactulose helps by enhancing intestinal excretion of ammonia. An older adult patient tells a home health nurse that she is taking methylcellulose for chronic constipation. Which behavior is cause for greatest concern? 1. Patient primarily eats white bread and drinks low-fat milk. 2. Patient takes the methylcellulose 3 or 4 times a day. 3. Patient takes the medication with a few sips of water. 4. Patient does not promptly act on the urge to defecate. The correct answer is 3. Patient takes the medication with a few sips of water. Rationale: methylcellulose can cause esophageal obstruction if taken with insufficient amounts of fluid. Intestinal obstruction is also a possibility if the passage is slowed or impeded. The patient should be reminded that 3 times a day is the acceptable dose range. High fiber and a prompt response to the urge to defecate should be encouraged to restore natural and normal bowel movements. A patient with end-stage liver disease is talking to the nurse about being on the transplant list. Which statement by the patient is cause for greatest concern? 1. I have a family history of diabetes. 2. I had symptoms of asthma when I was a kid. 3. I guess I should cut back on my alcohol consumption. 4. I am not very good about taking prescribed medication. The correct answer is 3. I guess I should cut back on my alcohol consumption. Rationale. If alcohol abuse has contributed to liver failure, a person's intent to continue alcohol consumption might be an exclusion for a liver transplant, so the nurse should conduct an additional assessment about this comment. The comment about the difficulty in taking prescription medications should also be investigated because a true inability to follow the treatment regimen could exclude a patient from being on a transplant list. The patient with advanced cirrhosis has massive ascites, peripheral dependent edema in the lower extremities, nausea and vomiting, and dyspnea related to pressure on the diaphragm. Which indicator is the most reliable for tracking fluid retention? 1. Auscultating the lung fields for crackles every day. 2. Measuring the abdominal girth every morning. 3. Performing daily weights with the same amount of clothing. 4. Checking the extremities for pitting edema and comparing with baseline. The correct answer is 3. Performing daily weights with the same amount of clothing. Rationale. All of these measures should be performed for total care of the patient. However, weighing the patient every day is considered the single best indicator of fluid volume. After a nasogastric tube is inserted, which assessment finding is cause for greatest concern? 1. The patient reports that the tube is irritating nose and throat feels sore. 2. Gastric contents have a coffee ground appearance. 3. The patient demonstrates coughing and cannot speak clearly. 4. Gastric fluid is bright red and has small clots. The correct answer is 3. The patient demonstrates coughing and cannot speak clearly. Rationale. Coughing and an inability to speak or difficulty in speaking clearly suggests that the tube has been inserted into the trachea. The tube should be removed immediately. Bright red blood with clots indicates active bleeding. This should be immediately reported to the healthcare provider. Coffee ground appearance of gastric contents indicates old blood. This finding should also be reported but is less urgent. Irritation of the throat and around the nares is commonly reported. Perform hygiene around the nares as needed. Irritation of the throat usually subsides, but an anesthetic throat spray may offer some temporary relief. The nurse is caring for a patient who was recently admitted for severe diverticulitis. Which task is appropriate to delegate or assign for the care of this patient? 1. Tell the unit secretary to call radiology and schedule a barium enema. 2. Ask the LPN/LVN to give as needed laxatives for constipation. 3. Instruct the nursing student to help the patient ambulate up and down the hall. 4. Tell assistive personnel to save a stool specimen to test for occult blood. The correct answer is 4. Tell assistive personnel to save a stool specimen to test for occult blood. Rationale. Diverticulitis can cause chronic or severe bleeding, so if there is no obvious blood in the stool may be tested for occult blood. A barium enema is not usually ordered because of the danger of perforation. Laxatives and ambulation increase intestinal motility and are to be avoided in the initial phase of treatment. If a barium enema, PRN laxative, or ambulation is prescribed, the nurse should check with a healthcare provider before delegating or assigning the intervention. A patient underwent an exploratory laparotomy 2 days ago. The healthcare provider should be called immediately for which assessment finding? 1. Abdominal distension and rigidity. 2. Absent or hypoactive bowel sounds. 3. Nausea and occasional vomiting. 4. Displacement of the nasogastric tube. The correct answer is 1. Abdominal distension and rigidity. Rationale. Distension and rigidity can signal hemorrhage or peritonitis. The HCP may also decide that these symptoms require a medication to stimulate peristalsis. Absence of bowel sounds is expected within the first 24 to 48 hours. Nausea and vomiting are not uncommon and are usually self-limiting, and an as-needed prescription for an antiemetic is usually part of the routine postoperative care. The NG tube should be assessed for displacement, and the correct position of the tube must be confirmed. The nurse then secures the tube as necessary. The nurse is caring for a patient with cirrhosis and portal hypertension. Which statement by the patient is cause for greatest concern? 1. I'm very constipated and have been straining during bowel movements. 2. I can't button my pants anymore because my belly is so swollen. 3. I have a tight sensation in my lower legs when I forget to put my feet up. 4. When I sleep, I have to sit in a recliner so that I can breathe more easily. The correct answer is 1. I'm very constipated and have been straining during bowel movements. Rationale. Portal hypertension increases pressure in the venous system and contributes to the development of esophageal varices, which are very fragile. Straining increases thoracic or abdominal pressure, which can cause a sudden rupture of fragile blood vessels with massive hemorrhage. The patient could have fluid accumulation in the abdomen that may be mild and hard to detect or severe enough to cause orthopnea. Patients will compensate for orthopnea by assuming a more upright position. This symptom warrants additional investigation. Dependent peripheral edema can also be observed but is less urgent. Generally, respiratory issues are the priority. However, this question calls for knowledge of pathophysiology of cirrhosis and portal hypertension. Rupture with hemorrhage is the most serious complication. An older adult patient tells the home health nurse that he puts 17 grams of polyethylene glycol in a large cup of coffee every morning. Which assessment will the nurse perform first? 1. Assess for signs and symptoms of dehydration or electrolyte imbalances. 2. Assess for signs and symptoms of malnutrition and nutritional deficiencies. 3. Ask the patient to describe frequency and consistency of bowel movements. 4. Ask the patient what he understands about the purpose of the medication. The correct answer is 3. Ask the patient to describe frequency and consistency of bowel movements. Rationale. The patient is taking the recommended dose of polyethylene glycol. Polyethylene glycol is used for the treatment of chronic constipation, so the nurse would assess the effect that the medication is having on bowel movements. Older adult patients generally have a greater risk for dehydration, fluid and electrolyte imbalances, and nutritional deficiencies, so these would be included in routine assessment. Reviewing understanding of medications is always a good idea if the nurse has time. The nurse is caring for an obese postoperative patient who underwent surgery for bowel resection. As the patient is moving in bed, he comments, "Something popped open." Upon examination, the nurse notes wound evisceration. Place the steps in order for handling this complication. 1. Cover the intestine with sterile moistened gauze. 2. Stay calm and stay with the patient. 3. Check the vital signs, especially blood pressure and pulse. 4. Ask assistive personnel to get sterile supplies. 5. Put the patient into a semi-fowler position with knees slightly flexed. 6. Prepare the patient for surgery as ordered. 7. Ask the charge nurse to call the surgeon. The correct order is 2. Stay calm and stay with the patient. 5. Put the patient into semi-fowler position with knees slightly flexed. 3. Check the vital signs, especially blood pressure and pulse. 7. Ask charge nurse to call the surgeon. 4. Ask assistive personnel to get sterile supplies. 1. Cover the intestine with sterile moistened gauze. And 6. Prepare the patient for surgery as ordered. Rationale. Stay calm and stay with the patient. Any increase in intra-abdominal pressure will worsen the evisceration. Placement of the patient in a semi-fowler position with knees flexed will decrease the strain on the site. Continuously monitor vital signs while the charge nurse notifies the surgeon. An AP can obtain sterile supplies. Covering the site protects the tissue. Ultimately, the patient will need emergency surgery. The charge nurse is reviewing the medication administration records for several patients. Which situation needs to be brought to the attention of the prescribing healthcare provider? 1. A patient with gastroesophageal reflux disease is receiving omeprazole. 2. An older adult patient with constipation is getting psyllium 3 times a day. 3. A patient who needs a bowel prep is getting a polyethylene glycol electrolyte solution. 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. The correct answer is 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. Rationale. Bisacodyl is a laxative and laxatives should not be administered to patients with undiagnosed abdominal pain, cramps, or nausea. Appendicitis, diverticulitis, ulcerative colitis, acute surgical abdomens, and bowel obstruction are also contraindications for laxative use. The other patients are receiving medications that are appropriate for their conditions. Omeprazole is a proton pump inhibitor that reduces stomach acid and relieves heartburn. Psyllium is a bulk-forming laxative that is used to treat constipation. The medication needs to be taken with a full glass of water. Polyethylene glycol electrolyte solution is a laxative solution that is prescribed to prepare the colon for procedures, such as a colonoscopy. The nurse is planning a treatment and prevention program for chronic bowel incontinence for an older patient. Which intervention should the nurse try first? 1. Administer a glycerin suppository 15 minutes before evacuation time. 2. Insert a rectal tube at specified intervals each day. 3. Assist the patient to the commode or toilet 30 minutes after meals. 4. Use incontinence briefs or adult-sized diapers. The correct answer is 3. Assist a patient to the commode or toilet 30 minutes after meals. Rationale. The goal of bowel training is to establish a pattern that mimics normal defecation, and many people have the urge to defecate after a meal. If this is not successful, a suppository can be used to stimulate the urge. The use of incontinence briefs is embarrassing for the patient, and they must be changed frequently to prevent skin breakdown. Routine use of rectal tubes is not recommended because of the potential for damage to the mucosa and sphincter tone. A nursing student is performing a colostomy irrigation. When would the nurse intervene? 1. Student hangs the prepared irrigation container on the bed rail. 2. The student puts 500 to 1,000 milliliters of lukewarm water in the container. 3. Student cleans, rinses, and dries the skin and applies a new drainage pouch. 4. The student encourages the patient to walk for 30 to 45 minutes for secondary evacuation. The correct answer is 1. Student hangs a prepared irrigation container on the bed rail. Rationale. The nurse will remind the student that the container has to be hung at shoulder level. If the container is too low, the flow will be sluggish. If the container is below the entry site, the solution will flow retrograde. If the container is too high, the solution will flow too quickly and cause cramping. The other actions are correct. For the postoperative care of a morbidly obese patient, which task best utilizes the expertise of the LPN/LVN under the supervision of the RN team leader? 1. Obtaining an oversized blood pressure cuff and a large-size bed. 2. Setting up a reinforced trapeze bar. 3. Assisting in the planning of toileting, turning, and ambulation. 4. Assigning tasks to assistive personnel and other ancillary staff. The correct answer is 3. Assisting in the planning of toileting, turning, and ambulation. Rationale. The LPN/LVN can offer valuable assistance in planning the interventions, but the RN has ultimate responsibility for the care plan. The LPN/LVN can delegate and assign tasks to APs. However, if the RN is a team leader, it is better if APs are not receiving instructions from multiple people. Obtaining equipment should be delegated to an AP. A physical therapist should set up specialized equipment. Which patient is the most appropriate to assign to an LPN/LVN under the supervision of an RN? 1. A patient with oral cancer who is scheduled for a glossectomy in the morning. 2. An obese patient who has returned from surgery after a vertical banded gastroplasty. 3. A patient with anorexia nervosa who has muscle weakness and decreased urine output. 4. A patient with intermittent nausea and vomiting after chemotherapy. The correct answer is 4. A patient with intermittent nausea and vomiting after chemotherapy. Rationale. Nausea and vomiting are common after chemotherapy. Administration of antiemetics and fluid monitoring can be done by an LPN/LVN. The RN should perform the preoperative teaching for the glossectomy patient. Patients returning from surgery need extensive assessment. The patient with anorexia is showing signs of hypokalemia and is at risk for cardiac dysrhythmias. The nurse is providing the immediate postoperative care for a patient who had fundoplication to reinforce the lower esophageal sphincter for the purpose of a hiatal hernia repair. What is the priority action in the care of this patient? 1. Elevate the head of the bed at least 30 degrees. 2. Assess the nasogastric tube for yellowish-green drainage. 3. Assist the patient to start taking a clear liquid diet. 4. Assess the patient for gas bloat syndrome. The correct answer is 1. Elevate the head of the bed at least 30 degrees. Rationale. The primary concern in the immediate postoperative period is the potential for airway complications. Elevating the head at least 30 degrees decreases the chance for aspiration and facilitates respiratory effort. The other options are also correct, but will occur later in the postoperative period. The ABCs, airway, breathing, and circulation, underlie the priorities of care when the patient has an invasive procedure. You can use the concept of gas exchange to answer this question, even if you are not familiar with the specific details of the procedure. In the care of a patient with gastroesophageal reflux disease, which task would be appropriate to delegate to assistive personnel? 1. Sharing successful strategies for weight reduction. 2. Encouraging the patient to express concerns about lifestyle modification. 3. Reminding the patient not to lie down for 2 to 3 hours after eating. 4. Explaining the rationale for eating small frequent meals. The correct answer is 3. Reminding the patient not to lie down for 2 to 3 hours after eating. Rationale. Reminding the patient to follow through on advice given by the nurse is an appropriate task for the AP. The nurse should take responsibility for teaching rationale discussing strategies for the treatment plan, and assessing patient concerns. The nurse is taking an initial history for a patient seeking surgical treatment for obesity, which findings should be called to the attention of the surgeon. 1. Obesity for approximately 5 years. 2. History of counseling for body dysmorphic disorder. 3. Failure to reduce weight with other forms of therapy. 4. Body weight 100% above the ideal for age, gender, and height. The correct answer is 2. History of counseling for body dysmorphic disorder. Rationale. Body dysmorphic disorder is a preoccupation with an imagined physical defect. Corrective surgery can exacerbate this disorder when the patient continues to feel dissatisfied with the results. The other findings are criterion indicators for this treatment. For a patient with short bowel syndrome, the nurse would question the prescription of which enteral formula? 1. High sodium content. 2. High fat content. 3. High protein content. 4. Modified carbohydrate content. The correct answer is 2. High fat content. Rationale. Patients with short bowel syndrome have impaired fat absorption as a result of limited surface area. Formulas with high sodium content would not be prescribed for heart failure. High protein formulas can contribute to dehydration if adequate water is not given. Modified carbohydrate content is prescribed for patients with chronic obstructive pulmonary disease when they require nutritional support. Which laboratory results would the nurse check to determine if there are untoward effects associated with vomiting, nasogastric suction, or lavage? 1. White blood cell counts. 2. Hematocrit and hemoglobin. 3. Serum electrolytes. 4. Blood urea nitrogen and serum creatinine. The correct answer is 3. Serum electrolytes. Rationale. The nurse monitors all laboratory results, but vomiting, nasogastric suction, and lavage can cause fluid and electrolyte imbalances. Fluid loss can cause hemoconcentration and artificially elevated levels for hematocrit, hemoglobin, and blood urea nitrogen. Blood urea nitrogen is generally more affected by fluid loss than serum creatinine. The WBC count could be elevated because of stress, inflammation, or infection. Which question will the nurse ask the student nurse who is assigned to do an enteral feeding for a patient with a small bore feeding tube? 1. Have you evaluated the nutritional status of the patient? 2. Is the patient tolerating the supine position after feedings? 3. Have you had any problems checking the residual? 4. Is the patient developing any problems related to the feedings? The correct answer is 3. Have you had any problems checking the residual? Rationale. A disadvantage of small bore feeding tubes is that they are prone to clogging, and checking for residuals can be difficult. If the tube gets clogged, it may have to be removed and reinserted. Placing the patient in a supine position is incorrect. The head of the bed needs to be elevated 30 degrees to 45 degrees during feedings and for 30 to 60 minutes after the feeding to reduce the risk of aspiration. The nurse is reviewing medication lists for patients who are being treated for peptic ulcer disease. The nurse is most likely to question the use of which medication? 1. Ibuprofen. 2. Omeprazole. 3. Amoxicillin. 4. Clarithromycin. The correct answer is 1. Ibuprofen. Rationale. Ibuprofen is a non-steroidal anti-inflammatory drug, and NSAIDs are thought to be one of the aggravating factors of peptic ulcer disease. Omeprazole, amoxicillin, and clarithromycin are used as a triple combination therapy for the treatment of peptic ulcer disease. A male nurse tells an older male patient that he needs to perform a digital examination of the rectum to check for possible fecal impaction. The patient responds, "I'm not letting any male nurse get near me." What should the nurse do first? 1. Explain that the procedure is a nursing action, not a sexual advance. 2. Ask the charge nurse to reassign that patient to a different nurse. 3. Document that the patient refused to allow the examination. 4. Ask the patient if the presence of a female staff member would be acceptable. The correct answer is 4. Ask the patient if the presence of a female staff member would be acceptable. Rationale. The nurse is likely to feel upset, even angry. However, ideally, the nurse focuses on the patient and tries to find a solution that allows the care to continue. Having a female witness in the room may reassure the patient that nothing untoward will happen. If the patient continues to express hostility and rejection, then the nurse could ask the charge nurse to reassign the patient. In cases of emergency, the nurse would acknowledge the patient's feelings, but politely and firmly explain that the intervention can't be delayed. All attempts and interventions should be documented. The nurse is supervising a nursing student who is caring for a patient who had a cholecystectomy. There is a T-tube in place. The nurse would intervene if the student performed which action? 1. Maintain the patient in a semi-fowler position. 2. Check the amount, color, and consistency of the drainage. 3. Gently aspirated the drainage from the tube. 4. Inspected the skin around the tube for redness or irritation. The correct answer is 3. Gently aspirated the drainage from the tube. Rationale. T-tubes should not be irrigated, aspirated, or clamped without specific directions from the healthcare provider. All of the other actions are appropriate in the care of this patient. The nurse hears in the handoff report that 1 hour ago, the healthcare provider requested that the patient be given the maximum dose of magnesium hydroxide. Which instruction is the nurse most likely to give to assistive personnel? 1. Patient will frequently need assistance to the bathroom for bowel evacuation. 2. Patient may experience some dizziness when ambulating or changing position. 3. Patient is frequently vomiting and may need linen and gown changes. 4. Patient needs to be encouraged and assisted to eat and drink as much as possible. The correct answer is 1. Patient will frequently need assistance to the bathroom for bowel evacuation. Rationale. The maximum dose of magnesium hydroxide is given for bowel evacuation and cleansing. It is expected that the medication should take effect within 2 to 6 hours. Patients who are undernourished or starved for prolonged periods are at risk for refeeding syndrome when nourishment is first given. What is the priority nursing assessment to prevent complications associated with this syndrome? 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. 2. Monitor for decreased bowel sounds, nausea, bloating, and abdominal distension. 3. Observe for signs of secret purging and ingestion of water to increase weight. 4. Assess for alternating constipation and diarrhea and pale clay-colored stools. The correct answer is 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. Rationale. Refeeding syndrome occurs when aggressive and rapid feeding results in fluid retention and heart failure. Electrolytes, especially phosphorus, should be monitored, and the patient should be observed for signs of fluid overload. Changes in bowel sounds, nausea, and distension may occur but are also appropriate for any patient with nutritional issues or for patients receiving enteral feedings. Observing for purging and water ingestion would be appropriate for a patient with an eating disorder. Changes in stool patterns may occur but are not related to refeeding syndrome. A patient is admitted to the medical surgical unit for observation after being evaluated in the emergency department for blunt trauma to the abdomen. Which instructions would the RN give to assistive personnel? 1. Check the patient's skin temperature and report if the skin feels cool. 2. Check the urometer every hour and observe for red or pink-tinged urine. 3. Check vital signs every hour and report all of the values. 4. Check the patient's pain and report worsening of pain or discomfort. The correct answer is 3. Check vital signs every hour and report all of the values. Rationale. The AP can take vital signs and report all of the values to the RN. In this case, all of the values are needed to detect trends. In other cases, the nurse may decide to give parameters for reporting. The RN should assess skin temperature and pain. The RN must also closely monitor the urine output, which is an indicator of perfusion and fluid status. In addition, red or pink urine can signal damage to the urinary system, transfusion reaction, or rhabdomyolysis. Which instruction will the RN give to the LPN/LVN to determine if the prescribed dronabinol, medical marijuana, is having the desired therapeutic effect? 1. Monitor and report bouts of nausea and vomiting. 2. Monitor the frequency and amount of diarrheal episodes. 3. Ask the patient if heartburn has decreased or resolved. 4. Assess for abdominal pain in the upper right quadrant. The correct answer is 1. Monitor and report bouts of nausea and vomiting. Rationale. Dronabinol medical marijuana is prescribed to treat nausea and vomiting. For patients coming to the ambulatory care gastrointestinal clinic, which task would be most appropriate to assign to an LPN/LVN? 1. Teaching a patient self-care measures for an ulcer. 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. 3. Evaluating a patient's response to sitz baths for an anorectal abscess. 4. Describing the basic pathophysiology of an anal fistula to a patient. The correct answer is 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. Rationale. Assisting with procedures for patients in stable condition with predictable outcomes is within the educational preparation of the LPN/LVN. Teaching the patient about self-care or pathophysiology and evaluating the outcome of interventions are responsibilities of the RN. In the care of a patient with acute viral hepatitis, which task would be delegated to assistive personnel? 1. Emptying the bedpan while wearing gloves. 2. Engaging the patient in diversional activities. 3. Monitoring dietary preferences. 4. Reporting signs and symptoms of jaundice. The correct answer is 1. Emptying the bedpan while wearing gloves. Rationale. The AP should use infection control precautions for the protection of self, employees, and other patients. Monitoring is a nurse responsibility. APs can report valuable information. However, they are not responsible for detecting signs and symptoms that can be subtle or hard to detect, such as skin changes. Engaging patients in diversional activities is the ideal. However, it is rarely possible on a busy medical surgical unit. The nurse is providing postoperative care for a patient who underwent laparoscopic cholecystectomy. What should be reported immediately to the healthcare provider? 1. The patient cannot void 5 hours postoperatively. 2. The patient reports shoulder pain. 3. The patient reports right upper quadrant pain. 4. Output does not equal input for the first few hours. The correct answer is 3. The patient reports right upper quadrant pain. Rationale. Right upper quadrant pain is a sign of hemorrhage or bile leakage. The ability to void should return within 6 hours postoperatively. Right shoulder pain is related to unabsorbed carbon dioxide and will be resolved by placing the patient in a Sims position. For the first several hours after surgery, output is not expected to equal input. What question is a home health nurse most likely to ask the patient to evaluate the efficacy of cimetidine? 1. Are you still having problems with constipation? 2. Has the medication helped to relieve the acid indigestion? 3. Did the medication relieve the nausea and vomiting? 4. Do you feel like your appetite has improved? The correct answer is 2. Has the medication helped to relieve the acid indigestion? Rationale. Cimetidine is available over the counter and is used to relieve heartburn, acid indigestion, and sour stomach. In which case would fecal microbiota transplantation be considered for a patient with Clostridium difficile infection, CDI? 1. Patient has had multiple recurrences of CDI treated with vancomycin or fidaxomicin. 2. Patient has CDI and a healthy donor who meets the criteria for donation is available. 3. Patient has had a recurrence of CDI after receiving a full course of metronidazole. 4. Patient has many risk factors for CDI and has poor nutritional and fluid reserves. The correct answer is 1. Patient has had multiple recurrences of CDI treated with vancomycin or fidaxomicin. Rationale. FMT is considered after the failure of medication therapy and after multiple recurrences. Vancomycin or fidaxomicin is the first-line therapy. Rifaximin is an adjunctive post-vancomycin treatment regimen for patients with recurrent CDI. Previously, metronidazole was considered a first-line treatment. However, it is now used only when vancomycin or fidaxomicin are not an option for the patient. Which task, related to a nasogastric tube, can be delegated to an experienced assistive personnel? 1. Removing the NG tube at the prescribed time. 2. Securing the tape if the patient accidentally dislodges the tube. 3. Disconnecting the suction to allow ambulation to the toilet. 4. Checking the suction after the patient has ambulated. The correct answer is 3. Disconnecting the suction to allow ambulation to the toilet. Rationale. Disconnecting the tube from suction is an appropriate task to delegate, but the nurse must give specific instructions or verify that the AP knows how to do this task. Suction should be reconnected by the nurse so that correct pressure is checked. If the AP is permitted to reconnect the tube, the nurse is still responsible for checking that the pressure setting is correct. During removal of the tube, there is a potential for aspiration, so the nurse should perform this task. If the tube is dislodged, the nurse should recheck placement before it is secured. A patient with proctitis needs a rectal suppository. A senior nursing student assigned to care for this patient tells a nurse that she is afraid to insert a suppository because she has never done it before. What is the most appropriate action in supervising the student? 1. Give the medication and tell the student to talk to the instructor. 2. Ask the student to leave the clinical area because she is unprepared. 3. Reassign the patient to another nurse and send the student to observe. 4. Show the student how to insert the suppository and talk to the instructor. The correct answer is 4. Show the student how to insert the suppository and talk to the instructor. Rationale. Showing the student how to insert the suppository meets both the immediate patient need and the student's learning need. The instructor can address the student's fears and long-term learning needs after he or she is aware of the incident. It is preferable that students express fears and learning needs. The other options will discourage the student's future disclosure of clinical limitations and need for additional training. For patients with peptic ulcer disease, what is the most important lifestyle modification? 1. Avoiding caffeine. 2. Decreasing alcohol intake. 3. Smoking cessation. 4. Controlling stress. The correct answer is 3. Smoking cessation. Rationale. Smoking is associated with peptic ulcer disease. The other lifestyle modifications may be desirable, but the current evidence does not show strong linkage to the development of or recovery from peptic ulcer disease. A patient with chronic hepatitis C has been taking a daily dose of the antiviral medication ledapaspir, so fosbuvir for the past month. Which information is the most important for the nurse to communicate to the healthcare provider? 1. The patient reports mild headaches that come and go. 2. The patient complains of feeling chronically tired. 3. The patient has missed a period and is having unprotected sex. 4. The patient reports nausea and occasional diarrhea. The correct answer is 3. The patient has missed a period and is having unprotected sex. Rationale. During pregnancy, this medication is prescribed with caution and only if clearly needed. The healthcare provider must discuss the risk versus benefits with the patient and then decide to continue or discontinue the medication. Headache, fatigue, nausea, and diarrhea are common adverse effects of ledapaspir, sofosbuvir, and should be reported if persistent or recurrent. The patient needs diagnostic testing to confirm symptoms of peptic ulcer disease, and the healthcare provider tells the nurse that the patient prefers non-invasive methods. Which brochure is the nurse most likely to prepare for the patient? 1. 3 simple ways to detect H. pylori using your blood, breath, or stool. 2. How your doctor uses a barium contrast study to detect peptic ulcer disease. 3. Esophagogastroduodenoscopy, the major diagnostic test for peptic ulcer disease. 4. Common questions and answers about nuclear medicine scans. The correct answer is 1. 3 simple ways to detect H. pylori using your blood, breath, or stool. Rationale. H. pylori is frequently associated with peptic ulcer disease, and the organism can be detected through breath, blood, or stool. Esophagogastroduodenoscopy is the best test for peptic ulcer disease. However, it is considered an invasive procedure. A barium contrast study may be ordered for a patient who cannot undergo an endoscopy. A nuclear medicine scan may be ordered if gastrointestinal bleeding is present or to detect gastric emptying disorders. The nurse is taking a report on an older patient who was admitted with abdominal pain, nausea, vomiting, and diarrhea. The patient also has a history of chronic dementia. Which comment by the night shift nurse is most concerning? 1. The patient has a flat effect in rambling and repetitive speech. 2. The patient has memory impairments and thinks the year is 1948. 3. The patient lacks motivation and demonstrates early morning awakening. 4. The patient has a fluctuating level of consciousness and mood swings. The correct answer is 4. The patient has a fluctuating level of consciousness and mood swings. Rationale. A fluctuating level of consciousness and mood swings are associated more with acute delirium, which could be caused by many things, such as electrolyte imbalances, sepsis, or medications. Information about the patient's baseline behavior is essential. However, based on knowledge of pathophysiology, the nurse knows that flat effect in rambling and repetitive speech, memory impairments, and disorientation to time are behaviors typically associated with chronic dementia. Lack of motivation and early morning awakening are associated with depression. A sudden change in the level of consciousness and mental status of a patient signals a need to conduct further assessment for an acute process. This question requires the ability to differentiate between acute and chronic disease processes and accompanying symptoms. The nurse is caring for a patient with peptic ulcer disease. Which assessment finding is the most serious? 1. Projectile vomiting. 2. Burning sensation 2 hours after eating. 3. Coffee ground emesis. 4. Board-like abdomen with shoulder pain. The correct answer is 4. Board-like abdomen with shoulder pain. Rationale. A board-like abdomen with shoulder pain is a symptom of a perforation, which is the most lethal complication of peptic ulcer disease. A burning sensation is a typical report and can be controlled with medications. Projectile vomiting can signal an obstruction. Coffee ground emesis is typical of slower bleeding, and the patient will require diagnostic testing. The nurse would be most concerned about a prescription for a total parenteral nutrition fat emulsion for a patient with which condition? 1. Gastrointestinal obstruction. 2. Severe anorexia nervosa. 3. Chronic diarrhea and vomiting. 4. Fractured femur. The correct answer is 4. Fractured femur. Rationale. A patient with a fractured femur is at risk for fat embolism, so a fat emulsion should be used with caution. TPN is commonly used for patients with GI obstruction, severe anorexia nervosa, and chronic diarrhea or vomiting. When a patient is being prepared for a colonoscopy procedure, which task is most suitable to delegate to assistive personnel? 1. Explaining how to assume the side-lying position. 2. Reinforcing the need for a clear liquid diet. 3. Administering laxatives as needed. 4. Administering an enema to prepare the bowel. The correct answer is 2. Reinforcing the need for a clear liquid diet. Rationale. The AP can reinforce dietary and fluid restrictions after the nurse has explained the information to the patient. Teaching the patient about what to expect is the nurse's duty. An enema is not typically part of the bowel prep, but might be ordered if the bowel is not empty or well visualized. The AP may administer enemas with special training and under certain circumstances, such as home care, but in this situation it is unlikely that this task will be delegated to the AP. Medication administration should be performed by the nurse.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.